Hello, everyone. Welcome in. We'll give a few minutes for people to come into the meeting. We'll start in 1 or 2 minutes, but welcome, welcome. Nice to have everyone here.
Yeah, welcome everyone. Yeah,
Welcome.
we'll just give a few minutes to just.
We'll give a few minutes for everyone to come in and get situated.
Yeah, we still see the participant flashing in.
Yeah.
We'll give us maybe another minute or two. In the meantime, a few housekeeping. There will be a Q&A box that you should see on your screen. That's reserved for any questions you have throughout our presentation about the program. If you have any technical difficulties or other issues that's not related to the Q&A for the program, please write those in the chat box. All right. We'll wait a little bit longer and we'll begin soon. Awesome. We see thumbs up. Okay, I think we're ready to go.
Yep.
Again, welcome everyone.
Okay, so let me open this session. All right, let's start. Hello everyone. Greetings from Singapore. Good evening, good afternoon, good morning to friends, colleagues, and potential students in Singapore and all over the world. Thank you so much for joining us today for the webinar to get acquainted with our Master of Science program in Nutrition and Lifestyle Medicine at the Young Learning School of Medicine, National University of Singapore. My name is Cuilin Zhang. Some of you may know me, I hope. I'm a chair professor in medicine at the National University of Singapore. Also, I'm the program director of the master program. I also have the privilege of being an adjunct professor in nutrition at Harvard University in the United States and an adjunct professor in medicine at Peking University in China. Just a little bit background of myself. So before moving to Singapore about 3 years ago, I was working in the United States for more than 20 years, where I was a senior tenured faculty at the National Institutes of Health. I was involved in strategic national nutritional research planning in the US as well. Nutrition and lifestyle medicine are close to my heart. I have the privilege of leading multiple national and international projects related to nutrition, lifestyle modifications, and metabolic diseases for many years. So today, along with me are my dear colleagues and two major program leaders, Professor Jeya Henry.
Hello.
And Dr. Zhila Semnani-Azad.
Hi, everyone.
So this session is designed, as some of you may know that, to give you a clear picture of the program and to show how it can support your career while contribute to the future of preventive care. As Dr. Zhila mentioned, at the end of the session, you will have the opportunity to ask our questions. So please always feel free to contact us for any questions, even after the webinar. We would love to hear from you. So with this, I'll turn this to Professor Jeya Henry.
Thank you very much. May I also extend a very warm welcome to all our friends and colleagues from this region. A warm welcome again. As Professor Zhang has said, I'm a part of the journey on the master's program, and I'm a nutritionist by training from the London School of Hygiene and Tropical Medicine, and spent almost 30 years in the United Kingdom and in Europe, where I also did considerable amount of work on nutrition for the UNICEF and the WHO. And I came to Singapore about a decade ago to found the largest clinical research center in Singapore. Our focus was on regional and global nutrition, and I've had an extensively passionate interest in nutrition. So when I was invited to form a program curriculum, I was delighted by this. And so I believe that this is a unique program, albeit in Singapore, for the world at large and Asia in particular. There are very few places in the world that can marry nutrition with lifestyle medicine. As you shall see, it's an international group of experts, and I believe that this will be a course that's of unique in nature, unique in vision, and I hope many of you will join our course to become thought leaders in this important area of nutrition and health that will benefit your own self, your region, your country, and the world at large. Thank you. Over to you, Zhila.
Thank you, Professor Henry. And echoing my colleagues, again, thank you so much for taking the time to be with us today to learn about the program. And we hope that through this presentation, you'll get an understanding of the importance of this master's program. Hopefully, we'll see your application and also show you the path that you can take through the knowledge you'll gain from the master's program that we're offering. So just a brief introduction of myself. As mentioned, my name is Dr. Zhila Semnani-Azad. I am the Assistant Director for the Master's in Nutrition and Lifestyle Medicine program. I also serve as a Senior Research Scientist in the Department of Obstetrics and Gynecology here at NUS, and a Senior Research Scientist at the Global Center for Asian Women's Health. Similar to my colleagues, I have a global background. I finished my PhD from the University of Toronto in Nutritional Sciences in Canada. And then I made my way south to Boston, United States, where I completed my postdoctoral fellowship at the Harvard T. Chan School of Public Health. My research focuses on the epidemiology of obesity and its relation to cardiometabolic diseases. And as you may know, nutrition and lifestyle factors are key important factors related to understanding obesity and disease risks downstream. So this, again, is very close to my training, close to my passion, and I hope you can see how much we've put into this program and how excited we are for you to engage in this program as students moving forward. In addition to my roles at NUS, I also serve as external editorial board member for Communications Medicine, which is a journal under the Nature portfolio, where I offer my expertise in nutrition and lifestyle medicine on the epidemiology platform. Okay, so we're excited to introduce to you this program, as we've mentioned, and again, we offer you a Q&A period at the end of our presentation. So again, to orient you, you should see a Q&A box on your screen. Feel free to ask any questions you may have throughout the presentation, and we'll get to it at the end. Hopefully, we can address all the questions you have. Again, if not, feel free to email us. The email is presented on the bottom of the slide here. So if we don't get to your question, again, go ahead and email us and we'll try to get to any questions that we didn't get to through that platform. Okay, so let's begin to put everything in context on the importance of this program. It is really essential to highlight that globally, we are facing a critical health transition. By 2050, more than 2.1 billion people will be over 60 years old, creating unprecedented demands on healthcare system. Now, at the same time, the rise of non-communicable diseases, those including diabetes, obesity, heart disease, cancers, as well as chronic respiratory diseases, is driving premature mortality and escalating healthcare costs. Alongside these trends, poor diet is recognized as a leading risk factor for cardiovascular disease and overall death, contributing to a significant portion of disability and mortality worldwide. Now, population aging combined with the growing burden of chronic disease underscores the urgent need for new preventive approaches. So lifestyle medicine provides that approach. It is built on 6 evidence-based pillars, those being good nutrition, regular physical activity, restorative sleep, stress management, minimizing or avoiding harmful substances, and building positive social connections. Now, together, these create a powerful framework to prevent, to manage, and in some cases, even reverse chronic disease. Now, across healthcare today, there is a critical shortage of lifestyle medicine practitioners. We see this gap in the community where preventive health and well-being efforts are urgently needed. We see it in the clinical practice where patient care and chronic disease management demand new approaches. And we even see this in corporate settings where workplace wellness has become essential to productivity and long-term health. Here, our master's program is designed to fill these workforce gaps. It will equip professionals with practical, evidence-based skills that can be applied directly to your careers and ultimately help to reduce the growing burden of chronic disease. Nutrition and lifestyle medicine provides strategies that can reduce non-communicable disease prevalence by up to 80%. That's a huge amount, and promote healthy aging. Yet, despite its effectiveness, these practices remain underutilized, which makes this program not just timely, but urgently needed. So this is where our master's program stands out, with a strong focus on real-world application. One of the unique aspects of our program is the ability to engage in a capstone project, where you will gain hands-on experience through internship, research, and community health projects. You'll learn in an interactive, engaging learning environment designed for flexibility. You'll explore both Asia-Pacific and global health challenges, ensuring that the solutions you develop are culturally relevant. And you'll expand your professional network by connecting with world-leading experts and institutions. Finally, the program is designed with flexibility, so this allows you to tailor your journey to your unique career aspirations. The master's program is really for anyone passionate about preventive health, and this can be that our students are engaged with others with very diverse backgrounds. Our cohorts are made up of physicians, dietitians, nurses, researchers, wellness advocates, and even career changers looking to transition into health and well-being. Now, an overview of the program curriculum I'm presenting on this slide. The program requires a total of 40 units, which can be completed in 1 full year as a full-time student, or 2 years if you're a part-time student. The curriculum is made up of 3 core courses, 5 electives, and a capstone project, as I mentioned earlier. On the right, you will see the list of courses, including electives. These cover a wide range of innovative topics, for example, culinary medicine, exercise as medicine, and sleep and mental health. You will also have the opportunity to cross-register up to 2 courses from the School of Public Health here at NUS or from the Department of Food Science and Technology. So this will really allow you to further expand your expertise and tailor your learning journey. This structure provides both a strong foundation in lifestyle medicine, as well as the flexibility to explore areas that are relevant to your career goals, or as you progress into the program, you may have different interests that you can further explore through these elective opportunities. Here you can see the full list of courses that are offered across the 2 semesters. The courses in the dark, as you can see, are the compulsory core courses, while the lighter blue represents the electives. And in the orange are the courses that you're able to cross-register from the NUS School of Public Health, as well as the Department of Food Science and Technology. Now, the timeline here also shows how courses are distributed across the semesters, with dedicated space for you to engage in your capstone project during the summer break. Overall, the structure is designed to balance academic training with opportunities for applied, hands-on learning and collaboration through your master's journey. A highlight of this program, as I mentioned, is the Capstone Project. So this is a really unique opportunity to collaborate with our esteemed partner institutions You'll have an opportunity to work with host organizations and advisors to design a project that applies your learning to real-world health challenges. For example, students may collaborate with leading partners such as the Culinary Institute of America. You may have projects that are in collaboration with Harvard University. We even have opportunities with University Paris City, among others. As well, if you're able to engage with hosts that may have projects relevant to your specific interests, you can also develop a capstone related to that. This experience often becomes a launchpad bridging directly into new career goals, research opportunities, and really building global professional networks. Now, graduates will be well positioned for a wide range of roles. So these could include specialized clinicians, nutrition professionals, private health coaches, workplace wellness managers, public health consultants, researchers, advisors. Really, the opportunities through this program will open up doors to several lifestyle and nutrition areas and fields that can span from research to applied. Now, with the global demand for preventive healthcare on the rise, this translates into career growth, leadership opportunities, and enhanced earning potential. But beyond professional advancement, the master's program also offers a chance for your own personal growth. The skills you gain in nutrition, stress management, and healthy lifestyle practices can help enhance your own well-being and build habits that can make you healthier while empowering others to do the same. So really, it's a benefit to yourself, to community, to potential career change, etc. Now, one of the most important and unique aspects of this program is that you will learn from global leaders in the field. We have an esteemed group of experts from NUS, the United States, through Harvard Culinary Institute of America, Spain, France, and others who will provide you with the latest evidence-based knowledge. So you're really going to be getting a global training through this master's program. We would also like to highlight that your training will be at NUS Medicine, which is ranked #1 in Asia and is globally recognized for excellence, consistently ranking in the top 20 globally. By joining us, you'll become part of a vibrant international community that is shaping the future of healthcare. We want to note that applications for our upcoming August 2026 intake will close March 31st. So please make note of that upcoming deadline, and we really encourage you to take this step today and put in your application and make the change that you want for a healthier life for yourself, for your community, and beyond. Now, again, if you have any questions, please do not hesitate to reach out to us using the email address that you've seen in the slide. I've also included it here. We also have a QR code here that will, if you scan, will take you to the website, which will provide you more information on the program, the courses that I had mentioned, as well as how to apply, the FAQs, and more. I also want to take this time to highlight the big team that helps put everything together and make this master's program a reality. We have a strong supportive staff and a supporting team in addition to our esteemed faculty who work tirelessly to make sure that you get the best program focusing on nutrition and lifestyle medicine. Now I'd like to open the floor to any questions you may have. We wanted to make sure that we had a lot of time to address your urgent questions, anything that we can help with the clarification and about the program. So as I mentioned, place your questions in the Q&A box. We'll be getting to it for the next 40 minutes. And if we don't get to your question, again, we highly encourage you to email us using the email address that's on the slide right now. And we'll hopefully get to your questions that way if we don't get to it today. Again, thank you so much for taking the time to be with us today. We hope we can address all your questions, and we look forward to seeing many of you in our program in August 2026 of this year. Thank you, everyone. And I think now we will open up the floor. So we will go through some of the questions here. And I think, Rachel, if you're able to also navigate, we'll go through those. It says, will there be a copy of this recording? I don't know if they'll be circulated via email through your registration, but we will hopefully share some of the recordings afterwards. Okay, let's see what we got. I graduated from nutrition and health, but now I'm not really a healthcare professional who works in a hospital, but rather a scientist doing research. Yes, so we see some questions about whether an individual who has a background in nutrition and health. This program is really open to anyone who's interested in nutrition and lifestyle medicine. So we have individuals who are currently practicing in the field, but we also have students who are looking to make a career change. So if the field of nutrition and lifestyle medicine is of interest to you, we highly encourage you to put in your application.
Can I just add to that? I don't think one should feel any hesitancy of joining a course, even if you were trained as a nutritionist, as I am, because the nature and the configuration of this course is so different. It's embellished on lifestyle medicine and also aspects like precision nutrition and state-of-the-art discipline. So in anything, you will grow in the intellectual prowess of your discipline rather than being duplicated. So I think, let me reassure you that even if you've got a nutrition background or a public health background, what we are providing here is very much a unique structure that has a very bilateral link between nutrition in its widest sense and lifestyle medicine, which is the unique narrative that we have put together for the Asian and the global region, as it happens, anchored in Singapore and the NUS and globe. Hope that helps.
Let me see what we have.
Yeah, there's someone asked about microbiome research. Yes, so I just briefly answered because this microbiome research will be covered in one of our courses, precision nutrition. So in that course, we'll discuss brief about the microbiome, the application of microbiome in medical research, and also in the context of nutritional research as well. So definitely, so our course, I saw another question related to whether our program is designed for academic researchers. Yes, so we have a research track for this program as well. And many of the, as you all know, many of the faculties, actually, they are world famous researcher, nutrition epidemiologist, nutrition scientist, top scientists in the world from the academic perspective as well.
And also to add, if microbiome is an area of the field that you're interested in engaging in, this could also be something that you could participate in a capstone project. So I know there's another question here related to the capstone projects. So one of the nice aspects of this master's program is that we will provide some opportunities to hosts who have signed on with the master's program. And there are several, including the Culinary Institute of America, as well as professors at NUS and participating hospitals. But if there are certain people or industries or sectors that you're interested in that maybe touch on microbiome, that could also be an opportunity. So we allow students to also go out and engage with their own areas of interest and find hosts that can also take them on for the capstone. So there is a lot of flexibility for you to really create the project that is of interest to you.
In fact, Zhila, there was a question on whether one could give some examples of capstone. So let me give some examples that are real life and to just add to what you said. So the capstone project should be one where your personal interest coincides with the expertise that we around here and also, as Zhila said, overseas. And I think Professor Zhang made the point. We have a lot of connections. Let me give you two examples to solidify the capstone project. Let's assume that you have an interest in how to make young children eat more fruits and vegetables. It's a behavioral science issue that we need to find mechanisms to improve the food intake, particularly fruits and vegetables in children. And that will become a capstone project. Another example, you are interested in culinary science, but you want to use pre and probiotics in your cuisine. what's the optimum food that you can provide the prebiotics? Should it be a congee? Should it be a pasta? So you can see how there is a lot of diversity and opportunity, but the key point is that it should have an anchor in your own personal interest, but also the ability for us to identify expertise that we are around the region and in our own institution, so that two together become five. I hope that helps. Thank you.
But many questions coming in, so this is great.
Yeah.
Looking through something.
And so maybe Zhila, it's helpful you can briefly like introduce the background for our current students. This could inspire some of the audience to get
For
a sense
sure.
about like which kind of students we are, their professionals, their background.
Yeah, for sure. So we have a very diverse cohort of students who are currently engaging in the program at the moment. We launched the program this year, and we have students who have come from North America. Their background is in naturopathic medicine, so they have some understanding of the scientific mechanisms of nutrition and lifestyle, and they've applied it in their careers. And they're using this program to enhance that and to further increase their knowledge on nutrition and lifestyle medicine that they can apply in their existing work. We also have dietitians who are also using this training to get connected with other members of the cohort, as well as professors and industries who have partnered up with the master's program to expand their network and to also improve in their career aspirations. But as mentioned, not everyone has a in-depth nutrition or lifestyle career at the moment. We have accountants who are doing a career shift, and they're really passionate about nutrition and lifestyle medicine, and are interested in the topic, the area, and are looking at what career opportunities are available beyond what they're exposed to at the moment. So through this master's program, you'll learn about the different career aspirations and and opportunities both within the Southeast Asia and beyond through the different networks that we will offer. But you'll also meet members in your own classes with diverse backgrounds. So you'll learn from each other. You'll build your network together. And through the capstone, we also hope that you can engage in topics that maybe have interested you throughout your life or in the more recent years that you really want to dive deep in, and potentially that could also influence some of your career aspirations beyond the master's program. So really, if you don't have a nutrition or lifestyle background, lifestyle medicine background, don't make that a hesitation. In fact, that's more encouragement for you to really explore this master's program and really dive deep, learning from the experts in the field and seeing what career opportunities are available for you that maybe you didn't know about.
Can I just add to that point? Zila is absolutely right. Please do not be concerned about the lack of background in nutrition or lifestyle medicine or even medicine. There was a question about whether I'll be disadvantaged. The short answer is no, because of three important reasons. First, each lecture is tailored to the knowledge dissipation without presumption of what you know, number one. Number two, we provide a whole host of reading material and prescriptive textbooks. And number three, all the lectures will be online for reflection and re-recording of it so that you can listen to it whenever you can. And most of all, we have weekly tutorials where we take you literally holding your hand intellectually, of course, on how you can grow your discipline. So don't be put off by the fact that you may not have a scientific background. As Zila pointed out, we got a whole tapestry of people from one extreme to another, including a practicing TCM for 45 years. He's with us. So it tells you very eloquently our course is very well targeted to the diverse forces, but most of all, very carefully tailored to take you through a journey incrementally so that you don't feel overwhelmed. But most of all, the journey will be together, and most of all, completely pastoral care so that you know that you're in good hands and you feel confident that you grow every month of the year.
Thank you, Professor Henry. I see a couple of questions about whether the courses are going to be held online or on campus. The courses will be primarily on campus. This will allow you to really engage with your peers, engage with your instructors. We have a whole host of experts who are going to be guest lecturing and providing insights from around the world. As we mentioned, we have supporters and faculty from the United States, from Europe, from different areas of Asia. So while it'll be lovely to have everybody on campus for those, some of those lectures will be held online, but some will also be live online. So as much as possible, this program will be available through on-campus learning. And I know there are some questions here about working while taking the program. Yes, we highly encourage you to apply even if you plan to work. We have several part-time students who are enrolled in the program right now. As I showed in an earlier slide, the full-time program will take about a year to complete. As a part-time student, it would take about 2 years. So you would distribute your courses across a 2-year span.
There are some questions on tuition costs.
Okay, tuition costs. Yes, the tuition cost is around 65,000. And I believe if you're Singaporean or PR, there is a rebate on your tuition fee of about 40%. So a bit of cost reduction there. Someone said they have a PhD in biotechnology and they want a career change. Are you eligible? Yes, for sure. Put in your application, and I'm sure your perspective in your prior career will be very beneficial for your peers as well to learn, and also you may offer some insight on different areas of work that you can share through potential capstone opportunities.
There's a question about a rebate. I mean, I think the rebate is almost like a discount that
Yes.
the government will pay you a recompense in lieu of your being a citizen or a PR.
Yes. Can someone from a non-health or nutrition background do this course? I'm seeing several questions about whether career background not being nutrition be relevant. Yes, we highly encourage your diverse background to be an applicant in this program. I think you learn a lot from people coming in from different areas of work and walks of life beyond having a nutrition or lifestyle medicine background. So if this is at all of interest to you, I highly, highly encourage you to put in your application before March 31st.
There's another question on English language requirements.
Yes, so the course, the whole program will be taught in English. So you are required to have a TOEFL score of 85 or an IELTS academic score of at least 6.0. So just make sure you have that prior to applying for the program. Someone is asking, women's health is something they're interested in. That's a great comment. Are there topics related to hormone health or metabolic differences covered in this program? Well, you're in luck. We are also part of the Global Center for Asian Women's Health. So Professor Zhang is actually the director of that center. So through the program, you'll learn about women's health, as well as there will be opportunities for capstone projects. So if there's something within women's health that you're really interested in and you enroll in the course, feel free to reach out and we can find suitable projects that would meet the requirements for the capstone. And I think we're actually taking on a couple of students this year for that.
Yeah, absolutely. And I think Professor Zhang is the world expert on women's health. So you're in very safe hands coming to this course because she's the expert. In fact, there was a question, Rachel, that you might be able to answer where somebody says, can CPF be used for this course?
Unfortunately, no.
There you are. That's the answer.
You can try SkillsFuture.
Yeah, there you are.
How long are capstone projects for? How long will we be overseas for? So there's different opportunities with the capstone projects. Usually how we have structured is in the first semester, you are finding your host, you're finding the project, you're developing the area of interest that suits you and your host. Again, we will have a host of people who could take on students for various ongoing projects. But again, we highly encourage, if you're interested in a specific area, you're more than welcome to reach out and partner up with appropriate capstone hosts. The general timeline for the project will take place around the second semester. So a few months where you'll actively engage in that project. There will be follow-ups both by your host and as well as your capstone instructor here at NUS to ensure that everything is progressing and you're really engaging in the project that you've signed on to do, and then there'll be a presentation at the end. Some projects can go on beyond the capstone period. So if there's a project that you're really interested in and you continuously want to participate and engage with your host, that could be done independently. But in terms of the capstone duration, it will be semester 1, it will be basically to develop it. Semester 2 will be to engage in it. And the time frame can vary a little bit, but there's some flexibility, but that's the general structure for this master's program.
There was a question here about whether being a non-citizen, one could get a scholarship to study in Singapore. The answer is technically no, but with a caveat. If you find a foundation or a grant-giving body in your region or country, we can help to support you with letters of recommendation for scholarships. But if you're a non-citizen, to get a Singaporean scholarship is quite a challenge. But we can assure you that we'll help you. So, for example, there are many foundations around the world that give out grants. The Gates Foundation, the Wellcome Trust, the Nestle Foundation. So there are many, the Tata Foundation. So I think you need to keep your eyes open, and we are happy to help you. And I think in that way, it'll benefit you and an institution to come and learn with us. But I'm afraid as a non-citizen, it's not easy for us to get a grant from the Singapore institution or the government.
There's also a question here about age limitation. No, there's no age limitation to apply for this master's program.
100 plus.
In fact, we have students with a wide range of age currently enrolled, from as young as early 20s to as young as late 70s.
Yep.
So feel free, if at all you're interested and this is something that you want to engage in, put in your application. Don't let age stop you.
Could you share some of our study schedule?
Sure. I don't know how the breakdown is finalized for the next semester, but at the moment we have the courses set up for one day. So right now the students who are engaging in the master's program come in on Thursdays and they have their courses throughout the day from the afternoon to the evening. And this is really to allow for part-time students to actively engage in the program, and also the full-time students have more time around the week to really study and talk to the instructors. So we are trying to accommodate both part-time and full-time students as much as we can. So we talked about financial situation. Let me see. Someone's asking about their undergraduate degree, and can they apply for the course? As long as you completed a bachelor's degree from a recognized undergraduate program, you're eligible to apply for this master's program. Do I have?
So part-time means you come on a Thursday, as Zhila said, every Thursday across the 2 semesters, but across 2 years. So the definition of part-time is that the number of modules you have to do remains the same, but it's separated into year 1 and year 2. And therefore, that allows you to do your work time with great commitment, but you have to come Thursday afternoon till, literally about 8 to 9 o'clock. That allows you a package of a quantum of knowledge, but spread across 2 years. That's it.
Yep. So you have to meet the core courses and then also have the elective courses, but you can choose how many you're taking across a 2-year period. So as long as you meet those requirements, then you're good to go. Oh, we have a question here, Professor Henry, about career prospects.
Oh,
Maybe you can go.
where do I start? I mean, I think career prospects are, to be candid with you, infinite. I tell you that with some degree of confidence because if you look at the global health sector right now, that plays a profound role on your health outcome, whether you're in an advanced country, whether you're in Singapore or the low and middle income countries. So therefore, understanding how food affects your health outcome is of relevance whether you live in Europe or Ethiopia or Singapore or Sudan. And that's point number one. Point number two is that if you look at the medical profession, you must have heard food as medicine is the metaphor. So many clinicians are now thinking, how come I cannot provide dietary advice apart from giving people pills? So that's a big area. So the paramedics and the medics are becoming a journey. And in the United States, there are some universities that have a Tufts University, for example, has a food as medicine curriculum. So Professor Zhang is bringing that idea here. And not too distant future, we'll have medical trained people with food as medicine as their paradigm. So that's item number two. Item number three is that the food industry is clamoring for people like you because everybody complains that food that the food manufacturers are producing is awfully bad, is killing us, is death. But if nobody helps them, they will be killing us. So it's for you to come in and say, how can I marry my science with food scientists and food processors to make quality food that's helpful, tasty, but also humanly helpful? Last is the global international network of United Nations, World Bank are craving for people with technical competence, because 1 billion people go hungry tonight from the lack of proper food. And I think many of them are women because women sacrifice their food for their families. So you have a huge challenge. For me, the opportunities are limitless. And I think this is why it's so important for any of you on this webinar to really think about joining this course because it will be the best investment you make. But most of all, you'll make an impact on people within your family, your region, your country, and the world at large. Not many institutions and not many subjects can do that. And if you think about it, this is why all of us on this course are so passionate.
Actually, you can see we all come from very different training and backgrounds, but we come together to support and help with this program because it's very important and it's all related to the different fields that we've engaged in.
So I noticed some students are curious about how the current course look like. So we do have a LinkedIn account actually, right, Zhila? So
Yes,
we
we
create
do.
a LinkedIn account. If you can search Master of Science, Nutrition, Lifestyle Medicine, so you can see we post our students' life over there. Our opening reception, dinner reception for the students. So the first week of the program. So you can, if you're interested in, look at our LinkedIn. You can have a great sense about how the students' life look like, and also some of our students they also share their perspective through LinkedIn as well. So for your information, so that is a great source for you to learn about the life and also the course for the current cohort. So the current cohort just started 2 weeks ago. Is that 2 weeks ago or 3 weeks
A
ago?
month.
A month.
A month
All right.
now. Yes, time flies.
Yeah.
A month ago. So that is a January cohort. But the current cohort will start in August. So the January cohort is more like a bridge cohort. Starting from the next cohort will be all start from August. So
Yes.
next one, the August 26th, and then the following one will be August 27th.
And yes, please search us on LinkedIn. You'll be able to keep up with the progress of the master's program, learn about the different activities that we're engaging in and students are engaging in, meet the potential classmates you'll have. If you start in August 2026, you'll have some opportunity to have shared courses with the current cohort. So definitely find us there. Find us on Instagram, same name, on Facebook, same name. We're all over the social media platforms. There's a questions here about how many hours of lectures will there be approximately every week. So each course, there's about 2 hours of live lectures per week and then 6 to 8 hours of prep, self-study, and assignment work. So if you're taking 3 a semester, you can expect 24 to 30 hours of work related for the master's program. And of course, that varies throughout the semester. So exam period, etc. There's some breaks here and there, but that kind of gives you a sense of if you want to apply as a part-time student, how much hours to allot for this program. Several questions around Capstone. The Capstone is a very unique aspect of this master's program. So I highly, highly encourage you to look into potential areas of interest, because if you're able to apply and enroll in this master's program, it's a nice opportunity to really get real world hands-on experience in areas that you're interested in and want to explore further. The question here is it included in the 1 or 2 years, or is it entirely separate commitment? So Capstone is one of the core modules of the master's program. So it is incorporated in the master's timeline. But some of the activities that you'll engage for the capstone may take place outside of, let's say, the Thursday lectures that you would have. So you do have to be mindful of the time commitment there. And again, there's a lot of flexibility based on the project, the host, and also various availabilities. So definitely look into it, and we're more than happy to discuss potential projects that you are interested in that may be feasible for the masters. Many questions, so that's great.
Great. Maybe just add a little bit to what Dr. Zhila just mentioned about the Capstone Project. Because just to share some background about like our thoughts for the Capstone Project. Because when we structure the course, we want to make it more practical as well, to really kind of pay more attention to translational work. Different from other courses. It's just talk about theory and knowledge, but we really want our student to expose to real life practice. So we made quite a lot of investment to talk with potential Capstone Project host. For example, we had a long discussion with the Culinary Institute in America, Culinary Institute of America in Singapore. So for our first cohort, a lot of them interested in going to the US actually to do the Capstone Project. So we make it happen. So we are in the process of formalize the agreement for that. So this is just an example. So as Zhila and Professor Jeya mentioned, so if we provide you opportunities, potential opportunities for Capstone Project. But meanwhile, for our students, we also encourage them to look into potential opportunities themselves, and we can facilitate the interaction and the connection as well. So it's like mutual interaction. It's not just we offer the opportunity. We also like to respect our students' interests as well and try our best to accommodate as well. Of course, we like our center is a global center for Asian women's health. We have quite a lot ongoing research related to nutrition, women's health, cardiometabolic disease at the molecular level, omics work, lab work, also through clinical intervention study, interventional trials as well. So if we are interested in research opportunity, we are very confident there's not lack of research opportunities even within our own program. Hope
Yeah,
this
that
is
was actually a
helpful.
question. Yeah, someone was asking about research opportunities outside of Capstone Project, so hopefully they answered your question. So there's many opportunities. You'll also engage with faculty around NUS and with the partnered institutions who are going to be giving guest lectures. So again, if there's an area of their research that you're interested in, it's a great opportunity to make your network and ask if there's ways that you can engage. So not just what's available directly through the program, but we highly encourage you to look beyond and really expand your network. Are there tests, exams, and graded projects? Yes, there will be tests, exams, and graded projects for the various modules, but they're structured in different ways. So each instructor has their way of developing the course. So some will have presentations where you're going to work in a group. Some they'll have the exams as you may be used to in an undergraduate setting where you have multiple choice, etc. There will be some tests throughout, some quizzes throughout. So they vary based on the course, the instructor, and the different topics that you'll be engaged in. Which countries are represented in this first cohort, please? So very diverse background, both career-wise, but also ethnically, which is great because that means you learn from your peers, you get exposure to different places, how things are done in different countries. We have international students from Canada, from the US, from China, and several students from local, so Singapore as well. So hopefully if you're not based in Singapore, this will encourage you to also put in your application because international students are welcome.
Yeah, so just add to that, in our first cohort, this inaugural cohort, we have majority of local students from Singapore. And then we have additional maybe 15 students, international students as well. Some of them like also from the surrounding countries, right? Like from India, from Thailand as well, and Indonesia. So this is what I can recall. So the other comment I like to make is that being engaged in a master program, to me, is a serious business. So I also, if I like to convey the message, if you're interested in learning and then to develop expertise in nutrition, lifestyle medicine, we also would encourage you to make commitment to it. So we try our best to offer flexibility and in terms of scheduling, and also try to accommodate our students' schedule as much as possible. But meanwhile, I think this is a serious like master program. We really encourage those who are interested in this. You think about, you commit your time, make commitment. If you think this is important for your career and for your life, it can really make a difference. It requires commitment from our students as well, even though we try to maximize the flexibility.
Definitely.
I can't agree more with that very important point that Professor Zhang made. We have put in a lot of effort and focus on developing a nice program. And I think it's very incumbent on our students to show commitment both in terms of time and devotion, because without that, you will not get the best out of our program. So if you feel that you just have to only spend time listening to our lectures, that's not going to fly. You need to put your effort on a regular basis, but at the end of the tunnel, your rewards are so enriching. And I think Professor Zhang's point is very, very important, that you must come with a heart full of passion, but most of all, also a heart dedicated to hard work. And I think that's the only recipe that will be of benefit to all of us.
Wonderfully said. We have about 5 minutes left for this Q&A period, so maybe we'll take one or two more questions. And if we don't get to your question again, we highly encourage you to email us using the email that's on the screen. The QR code here will take you to the program website where you can learn more about the program, the teachers, The frequently asked questions will also be there, so maybe that will answer some of the pressing questions that we haven't been able to get to. We have several here, so we're really navigating through the pile, but that's great. We're very, very happy to see your engagement. One question here, maybe we'll end off on this question. What is the balance of focus of the curriculum between curriculum and faculty between nutrition pillar and the other 5 lifestyle pillars, which is very important. While this is nutrition and lifestyle medicine, there would be emphasis on the 6 major pillars of lifestyle. So you're going to learn not only about nutrition, you'll learn about exercise, you'll learn about sleep, you'll learn about stress management, connection, as well as substances for avoiding and minimizing. So we really want to have a holistic approach on understanding the major pillars of lifestyle medicine. So if any of the other pillars are of major interest to you, you will learn about those and you'll engage with experts from those fields. We actually have one instructor among many others, actually, but she's the former president of the American College of Lifestyle Medicine. So if you have any questions about the pillars specifically, I'm sure she'll also have a lot to say and maybe a great network for you to explore. But yes, the program is structured where there'll be emphasis on all of the 6 pillars that we had mentioned earlier in the presentation. So I guess we'll wrap it up there. Thank you again for attending our info session. We hope to see several of your applications come in. Again, the deadline is March 31st of this year for the August cohort. I'll open up the floor if Professor Henry or Professor Zhang, you want to say anything else to the cohort. But again, thank you so much for your time, and we are looking forward to welcoming you in August 2026.
Absolutely. More than
Yeah.
clear.
Yeah, the same here. We're looking forward to see your application. Don't hesitate to try.
Absolutely.
Without a try, maybe you never know, right? Nothing will happen.
Exactly. And follow us on LinkedIn. You'll learn more
Yeah.
through the program as it
Thank you.
progresses. Thank
Thank
you,
you so
everyone.
much.
Thank you, everyone.
Thank you.
Bye-bye.
Bye, everyone.
Bye-bye.